guys, it's Kate. So today I want to talk a little bit about foam rolling. I feel like people tend to have kind of a love-hate relationship with foam rolling, which rightfully so. I feel like because sometimes foam rolling can feel really, really good, and other times it's a bit painful, and even sometimes a little bit awkward because I feel like we're trying so hard to get ourselves into these weird, awkward positions to get to the area that we need to roll. That said, I think foam rolling is such an important tool that we have for myofascial release. All that means is myo just means muscle, and fascia is kind of this connective tissue that makes up your whole body. The analogy that I like to use for fascia, for those of you that aren't familiar with it, is you know those big tubs of licorice that you can find in the drugstore. So if you think of each individual licorice candy itself as the muscle fiber, and the plastic, so that includes the plastic that's wrapped individually around each licorice and the plastic tub that it's all sitting in, all the plastic is the fascia. So basically what that means is that if the fascia is restricted, or if there's, problems with alignment, then that's going to cause some issue with functionality and health of muscle tissue. So getting the fascia kind of nice and pliable is a really important part of muscle health. So today I'm going to have you guys do with me, if you want to. You don't have to, you can do this after you watch the video, but today I'm going to show you some techniques for easy foam rolling of your hips and your glutes. So if you can't tell, I'm on a foam roller right now. I'm going to roll this back a little bit so you can see what I'm doing. So you are actually going to start just like this, like me, sitting on your foam roller, just taking a seat. And you're just going to start doing some nice little back and forth rolling. And don't worry too much about kind of technique to this, because the easier the better, and you don't have to worry about what muscle am I on right now. Really, this is more about working through the fascia, which is pretty much everywhere. So rolling back and forth, and then if you can't see, here, let's turn this sideways so you can see it a little better. To get a little bit higher up on your glutes, you can put your hands behind you and get a little higher up. And if you want to get a little bit lower down on the glutes, you bring your knees in a little bit closer. Hello. Bring your knees in a little bit closer and roll in there. And then once you've gotten that nice and warm, go ahead and bring one arm to the side and just start rolling on just one glute, one hip by itself. And if you're finding that you're like, ooh, there's an area in there that's really tight, take your time there. That's what this is all about. And if you're feeling like you're almost getting to it, but you're not quite there and you can't figure out how to maneuver to get that specific place, try crossing one leg over and then slowly rolling through some of that area. And if that still isn't getting right to the spot that you need to get it at, try crossing the other leg over, setting it on the floor. And so now you are turning that hip that's being worked in as opposed to turning it out. So you're maybe getting a little bit different angle at those muscle fibers. So you're going to do both sides. So just start by setting one hand on the ground behind you. Just rolling back and forth on that one hip. And try crossing the leg over. Don't forget to breathe. I always forget to breathe. So then, if that's not enough, bringing this other leg over and rolling through. And again, foam rolling can be something that you do quick movements, and then it can also be, I tend to find that the slower the movement as you're rolling through something that's really intense is better, because it should feel, go ahead and come back to center, and you can go back to this, it should feel really intense, but also like a productive movement. So if it's feeling really intense just for the feeling of intensity, that's probably not good. But if you're feeling like, ooh, this is an intense feeling, but it's kind of that hurt so good intense, then you're probably on the right track. So when you're doing kind of all of this, take your time, find the spots that are painful, find the spots that are in need of a little more love, and breathe through those. But you don't need to get yourself into pretzel twisted positions to be on a foam roller. Sometimes you just have to sit on it. So that's it for today, guys. Have a great, great day, and I look forward to seeing you back here soon. Be well.